on the website? Oh, thank you very much for that. Forgot about that recording. So the other thing is that if you are interested or know someone who's interested, please feel free to send in your bio. You can send it to the link on the website for the PDPPC. I believe that's what it is, right, Danny? I see you put
Yes,
it up
Kurt.
there. Thank you much.
Yep.
And then, so you can do it there, or you can send it directly to myself or Kevin. Um, my email address, I'll try to put that in here one more time. I know I'm also in the training manual as well as other places. I'll just quickly mention what that is, and I'm going to type it in shortly here as well. All right, so it is my name. It's Curtis, Curtis, L as in Lewis, wolf@gmail.com. And wolf is with two F's. I always say F after two F's are better than one. So Curtis L.wolf@gmail.com. All right. And then I'll put that in a little bit later here. So anyone who wants to do that, Kevin, if you want to share yours, I know you're having audio problems. If you want to put that in the chat, fine. I'd appreciate that. Um, with that said, does anyone know of any interest? Our qualifications are pretty simple. Anyone who's the stakeholder, we would prefer to be a voting member. That someone just didn't jump in here. But we're looking at probably the same thing, and certainly I would like to open the floor to discussion if we want to keep it to two. Do we want to consider it maybe being three people? What are your thoughts, everyone? Anyone at all?
Hey Kurt, this is Oliver. I'm curious to think what you have the experience as co-chair. What do you think? Is two good? Would you like more help? What are your thoughts?
Good question, Oliver. So my thoughts were, um, I like to have it to be again continue to be a collaborative. I like that we had two chairs. My experience personally is on the CDASS side. I have very little, if any, experience at all. And my apologies, everyone. My phone's connected to my Bluetooth, so sometimes I cut out. Um, but again, Oliver, my experiences with the CDASS program, I'm pretty good at this consumer direction. However, when it comes to the IHSS, and now with the upcoming children being on it as well, it might be not a bad idea to have maybe a person running it and maybe two co-chairs. So maybe that's one thought I was thinking, possibly a chairperson and then two co-chairs. So it would be more of a collaborative to kind of cover all the different avenues of the self-directed program.
Thanks, Kurt. I like that idea.
Yeah. Anyone else? Oh, I see Patricia has how much time is needed for this commitment. Um, it's kind of a little bit up to you. I know that actually starting tomorrow, we actually have after our meeting, we have a kind of a summary session of things that were talked about, and then we start setting the agenda for the next meeting. While things are fresh in our head, we do that. That's about an hour, and then I'm going to say throughout, that's meets with the state people. We get this agenda with Danny and with Jessica and others. Emily Harvey helps with it a lot. With all that, we come up with that agenda based on what your guys' input is. So that's about an hour the next day. And then the other commitment is just kind of paying attention to emails and listening out to the community. And so you can bring things up to the group and kind of help direct this. Again, it is participant directed. So I'm going to say it's another hour or two. And for a lot of us, it's what we do every day anyway. So maybe another couple hours or so a month at the most to be involved in it. And of course, running these meetings and participating in this once a month. Hi, Michelle. See, you're here.
And Kurt, it looks like we have a couple of hands up. I think Ashley had her hand up first and then Nathan to follow.
Okay, let's go. let's start with Ashley then.
Okay, hi. I was just wanted to comment on the leadership team. What would it look like if we had somewhat of a board where one person, was kind of like the executive director that did the talking, and everything, but we had somebody who was an expert in IHHS and CDASS, where we kind of had like a whole board of people together that kind of helped set the agenda and the tone for the meeting.
I think it's a great idea. I was actually contemplating that a little bit more this morning as I was preparing, going, we are a collaborative, and I know on other board of directors and things I sit on, it basically is a board of directors that kind of facilitate it so we can come up with this agenda together. And I like that idea a lot. So, but I'm thinking we don't want to give us too many people where it's a complete quorum of discussion. So I think that's a great idea. That's what I was thinking. Who else we have on has a hand up here? It's hard for me to see this here.
It looks like we now have Michelle and then Robin.
Okay, let's go next and with did you say Michelle was next? And then Robin?
Michelle first, that's correct.
Okay, Michelle, what do you got here?
Hi, and I apologize. I had another meeting that ran late, and I was hoping to jump on before the first agenda topic. Can you guys just give me the quick highlights of what the leadership announcement was? I apologize.
Sure, we're actually in it right now. Basically that starting off with, I'm going to be facilitating the meetings moving forward with the PDPPC group here. And then we're really basically, we talked about applications for the chair job. And right now we're simply discussing what our options might be. Basically, whether we should have maybe a chair and then maybe two co-chairs besides, kind of thinking of covering the three different venues between the children's special assistants that's coming on board, as well as the IHSS and the CDASS. So that's where we're at right now. And we won't make you get punished too bad for being late, but we'll forgive you.
Thank you. I
All right.
appreciate that.
Great. Hey, Robin, what's up? I see you got your hand raised.
Oh, yeah, I guess I have some concerns in having a history of the program with some of the comments that are being made, and not criticism, concerns. So this committee was developed by consumers for consumers to impact on policy about consumers. So up until now, chairs needed to be consumers, not even someone like me who's a family member. But it's, I absolutely agree, given what's going on with CFC and children being added, which is wonderful, adding other folks that are in some way consumer family members being consumers. When we start to add professionals, that's where I get concerned, because the program is consumer. And there are lots of places for professionals to have input into this program. And professionals don't have the same needs. They don't have the same perspective as consumers. So this was supposed to be a place for consumers to impact on public policy, whereas professionals have lots of places for that to happen. And what happens when you add a lot of professionals, and I used to be one, so I get it, in these committees in a place of authority and power, sometimes it's hard for consumer voices to be heard. And there are folks that may not even feel comfortable speaking out when that happens. So I would push that we keep with the original principle of consumer directed, and that we expand that to family members, since they are now going to be consumers as well.
Okay.
That's
Thank
it.
you, Robin. Thank you, Robin. And just so everyone knows, I believe really, really strongly in consumer direction, and it's our true self-direction that we are the people in charge. But I do appreciate family plays a big, big role in this. But I want to make sure everyone understands that we are advocating on behalf of everyone. And in order to do that, especially with the children coming on and CFC coming on, I like that idea that maybe we consider having a chair and two chairs. Any other thoughts with anyone else regarding going that route? As far as right now, we have two people have applied. I'm thinking I would like to probably apply again. Anyone else who's interested, please feel free to join that. Michelle, I see you have your hand raised up again. Go ahead.
Yeah, I just kind of wanted to speak to Robin's comment. And first I want to say, you know, I'm fairly newish to PDPPC. And so I respect what this collaborative was originally created for. And I do agree with Robin that it does need to be more consumer driven, not as many professionals, providers, so that it's a safe space for consumers to voice their opinions and be heard. I just want to clarify. So we're talking about, well, now that the kids are going to be added to this with CFC, children already access IHSS, which is still technically a participant-directed program, albeit a little tricky because obviously a 6 or 7 month old who's receiving IHSS is not going to be able to advocate for themselves, hence why the family members. I think I'm just looking for clarification. When we talk about this collaborative moving forward, are we trying to recognize the children on IHSS that have historically been accessing IHSS and then those family members?
Well, sure. And then, so I'll just share with everyone my thoughts on it, and then we'll kind of move on here. We're about into that open forum area here. I think the ultimate thing is sometimes agencies or people in charge of authority tend to think they know best. And I think that's the point Robin was saying. This is supposed to be the true directed part. With that said, especially in the light of the CFC and the children's program, and for a long time, and I believe Kevin can speak to it, we've really wanted more IHSS being active. I think the problem is a lot of times in the past, a lot of people don't really feel like they have control other than hiring their family because the agency tends to budget for it. But I believe it is a version of IHSS. Don't get me wrong. I just think we got to make sure that we wear the right hats when we're in the meeting, as far as being true advocates of the self-direction as consumers, as opposed to what maybe an agency would want to direct. All right. With that said, we have our open forum session here. We got time here. If no one has anything more to speak on regarding this leadership role, I think we'll talk about maybe having 3 positions as opposed to 2. All right, anything for the open forum? If you want to put something in the chat or queue, raise your hand. Let's go through that step here. Robin, I see your hand is raised. Anyone else? All right, Robin. Ready when you are.
Okay, I'll try to keep it brief. But
No worries.
thank you, Kurt, for the comment about passion. I was actually going to say something about that today, that there's a fine line between passion and anger. And in these meetings, we often discuss things that impact on literally life and death situations. And we've already spent days filling out paperwork and justifying our existence and sharing incredibly personal information with lots of strangers and not always getting the answer that we want. So when we come to these meetings, our passion can often look like anger. And I think that needs to be respected, that there is a time and place for anger. Now, screaming at people at the meeting, not appropriate, but, you know, I've been told not to raise my voice, and sometimes that's appropriate. And it does get back to even what we were discussing about co-chairs and professionals. It's like, if someone was putting your loved one's life at risk, you might raise your voice. So let's just respect where we are coming from, and that it's okay to be passionate, and there could be a tinge of anger to that. So thank you, because in the past, Kurt, you know, that's been shut down. And it's not okay to shut down righteous anger.
All right.
So
Well, and
there we go.
I appreciate that. So we'll go there. Thank you very much, Robin. Anyone else as far as the open forum, any things you want to talk about or things we want to just throw out there? Again, we're not trying to solve problems, but we are trying to share. And I think that's really the most important thing that we're trying to do here. All right. So what do we got? Anyone else raise your hand or put some information in the chat box? And again, Danny, if you see something in the chat, I'd appreciate it. Okay, Damien, I see you have your hand raised.
Thanks, Kurt.
You bet. How you doing? Let's what have you got for us?
Thank you. I was just curious about with IHSS and CDASS, how are we doing with working with case management redesign and having people that have not typically been working with these programs. Now they're case managers, so they don't know IHSS, they don't know CDASS. This is relatively new. I'm just wondering what the state is doing, what we're doing to kind of broaden this so people understand what they're talking about.
All right, that's a great question. I think we might cover some of that today. And Dan, if you can make a note, it might be something we should address maybe at the next meeting. I know we have things changing a lot with developmental pathways and a lot of changes in SEP agencies. Maybe that's something we could address if we have time today, or if not, for sure, put that on the next agenda. All right.
Yeah, I'll definitely take a note. And Damien, I just wanted to confirm your question is really what is the state doing in general to ensure that case managers and new case managers through the case management redesign process have the resources available to broaden IHSS and CDASS. Is that
right?
correct?
And I'm thinking, Denver and Denver Metro, it'd be developmental pathways, learning about these new service delivery options, and then in Fort Collins, it'd be Foothills Gateway. I mean, the single entry points would understand these programs, but the CCB is not as much, and they'll need to know. Everyone will need to know this by next year. So, yeah.
Right.
Sure. Yeah,
awesome.
we can take
Great.
that back and get our case management unit to hopefully give some clarification on that too.
All right. That's a perfect example of what we want to do here. Use these open forums, not to solve the problem right now today, but definitely get things thrown on the next agenda so we can address it moving forward. Michelle, I see you've got your hand raised.
I just wanted to throw in there, and whenever I come to these meetings, I come as a parent first and foremost, but I am also a professional. And so just wanted to kind of respond to Damien's comment, letting him know that for case management moving forward, the required training has drastically changed. And as case management goes into training for the Colorado single assessment, one of the topics as part of that is specific to participant-directed programs, CDASS and IHSS. And so in summary, all case managers will have to go through mandatory training on CDASS and IHSS over the next year.
That is sweet to hear. All right. Well, I'm looking forward to talking to that in more detail next week. We are about at the time limit. I'm going to be true to my word and say if we have anything else so we want to bring up right now, that's fine. However, we do have another forum popping up here shortly. Part of our keeping our agenda, just so everyone knows, is a lot of people are coming in just for certain parts of the agenda based on our time frame. So my apologies right up front if I'm cutting people off to keep things moving. It's not to be short, but I will definitely make sure that you can bring things up later on if you need to. In the meantime, though, let's move on. We have from 125 to 210 case management and eligibility Q&A. I see that is staff and Amanda L. Are you guys there? Oh, Danny, I see you have your hand raised. Sorry, Danny.
No, all good, Kurt. Just really quickly before we move into that, I did want to let you know that we had a last minute shift in the agenda. So the CFC update is actually going to have to occur during the breakout room report out. So We do have about 10 minutes to play with before the break, just so you know. And apologies, that was so last minute.
Oh, no, that's okay. That sounds good. All right. Are we ready for the case management eligibility questions? I know there's a lot of passion and a lot of good things happened last month after the discussion. So if we have anyone ready to talk about that with the staff, or if Amanda is online.
Good afternoon. Can you hear me okay?
I can. Thank you very much, Amanda.
Well, thank you everyone for letting me join you this afternoon to talk about current long-term services and support strategies and challenges. I know there was a lot of discussion, or has been probably a lot of discussion over especially the last 6 to 8 months as we've gone through the public health unwind. And so wanted to share with you all today. I have some slide decks, but certainly as we go through questions, happy to take questions and discuss those as we go through. But really the department's intent, if we go to the next slide, our top priority is ensuring coverage for all of our LTSS members. And we know that through the last several months, that has not happened in all cases, and there has been impact. And so we've really worked on identifying short-term and longer-term strategies to mitigate inappropriate terminations, and then look back retrospectively to identify who has been terminated that should not have been, and working with our counties and case management agencies to get folks reinstated. We have 5 areas that we're currently tracking at a high level really closely to come up with strategies and solutions. And so if we go to the next slide, one of them is, as I mentioned, inappropriate terminations during the renewal process. Sometimes this is happening because there's a delay in getting the level of care to the counties, or as many of you are aware, the counties in some areas of the state have had a backlog in processing those. And so making sure that individuals are not terminated because those level of cares have not been processed. The other area that we're working very intently on is prior authorizations and making sure that members have prior authorizations for the services so that providers can get paid, and looking at short-term and longer-term strategies associated with that. And then I forgot to introduce myself, I apologize, but my name is Amanda Lofgren, and I'm the Case Management and Quality Performance Division Director. And so I work really closely with the case management agencies across the state. And in July, we implemented a new care and case management IT system. Historically, they have been using 2 and sometimes 3 different systems. And so we created a singular one. And it has had some challenges for the case managers. And then in February, we introduced some streamlining between our care and case management system and the system that the counties use that has also identified some challenges for the case managers to be able to do their day-to-day job. And so we're working really hard to get those fixes in place so that they can be able to do things on a day-to-day basis much more effectively and efficiently without the system getting in their way. And then case management, I heard you mention case management redesign, Damien, and so I appreciated that. And so as we are transitioning across the state and creating singular case management agencies that serve all members, those transitions started in November. We had a group transition November 1st. We had a second group March 1st, and then our third group will transition July 1st. And so we're really monitoring case management agencies' capacity and their ability to navigate through those transitions. And then the last one is just making sure that we are improving upon our communication from the department out to members and our community partners. So they're aware of, everyone's aware of what's going on, but also when we have issues, what's happening, what's causing those, and how we're going to fix them. So I'll walk through each of those and talk about short-term and long-term strategies that across the department, all the way up with Kim Bimsteff, our executive director, to all of our office directors. You mostly know Bonnie Silva. We're all really working hard and across the office to make sure that we're solving and making improvements so that we're not impacting services. So the next slide we do, I just want to talk about before I jump in, the emerging issues. I mentioned that in February, we had what was called streamlined eligibility. And this is where case management agencies no longer will have to submit to counties a paper copy or an email or a fax of an individual's level of care certification. That will be, it will travel from our care and case management system to the county's IT system. It will get approved and then come back to the care and case management system. There is some areas where the automation doesn't happen, and it's requiring case managers to do a pretty intensive manual multi-step process. And so we are working with the vendors to get that automated. And then there is instances where there is a mismatch. And so the eligibility on the county side and what is showing in the provider portal or in Peak Pro is not matching for members' eligibility. And so we are working on identifying what is causing that and coming up with a solution so that we can resolve those outstanding issues and make sure that members' eligibility is showing accurately across all of the systems. And then the other area that's an emerging issue is there is a backlog and delay in disability determinations. And so the department's working closely with the vendor to understand and collaborate on how we can mediate these delays and get them moved through. One of the areas that we've been informed of that's causing this a lot is mostly the medical records. And so working with the medical provider industry partners to really make sure that they're able to get that to the vendor in a timely way so that it's not impacting the redeterminations. So department will continue to put out communications as we work through these emerging issues and have more information on them. But if we go to the next slide, inappropriate terminations, and this is where during the public health unwind, there were members who were lost at financial eligibility due to pending or missing level of care assessments or other procedural reasons. Maybe somebody dropped off of application and it didn't get processed, and then the timeline lapsed, and so the redetermination process, they were terminated from financial eligibility. And so the department has 3 areas that we're working on to mitigate long-term services and support terminations. And so if we go to the next slide, the first one we're doing is pausing all long-term services and support terminations for all reasons for 2 months. This 60-day extension for members terminating from long-term care includes nursing facility, home and community-based services, PACE program, and our buy-in programs. If eligibility is still pending due to any missing documentation, with the exception of if somebody moves out of state or has passed away, they will not terminate individuals. And then counties will be able to also implement what's called a good faith extension, meaning that they can have an extended timeline for processing those applications. So communication has gone out to counties as well as training to really make sure that they understand how to apply that good faith extension. The other thing that we are working on is applying a 12-month extension to level of care certification end dates that are within CBMS. So for all active members with level of care records, we'll extend the level of care end date for 12 months on the back end so that when a level of care end date is set to expire within 30 days, it will not. It will auto extend. This will be a monthly process and will extend to all level of cares that expire within the month or the next month. This will be a continuous process so that the level of care can continue to be updated if a new level of care is not entered. So if a new level of care is entered, this will allow the extension to be overridden by our county system, and it will be updated appropriately by the eligibility worker. So this is what we're working on with our county partners. We're also working on making sure that the counties where we have identified the largest backlog, we're working closely with them so that they have resources and are able to work through and stay caught up in processing. We've been able to leverage some of the application partners across the state. There's 3 of them. One of them is also the Denver Health, to help reduce the backlogs in certain counties that have the highest. The other thing that I just want to share is we are working on a system solution so that now that we have streamlined eligibility in place where the case management system and the county system are speaking to each other, any of those level of care certifications that were submitted to counties prior to February will be automatically resubmitted through this electronic interface between the systems. And that will reduce the requirement for a county worker to go in and manually process those. So that effort is not happened yet, it is underway. If we go to the next slide, really looking at prior authorizations, requests, and provider payments. And we know since the beginning of the public health emergency unwind that we've had providers have experienced challenges with billing, with the renewals, and now with case management transitions and the care and case management system. We are having some technical difficulties with the PARs and making sure that all of the systems are syncing up. And so we really want to make sure that providers are getting paid and we are able to have some workarounds until all of the systems are in place and working as intended. So if we go to the next slide, one of the things that we are working on is auto extending prior authorizations for those members who don't have current prior authorizations in the claim system. And so the system will basically duplicate the member's prior authorization from the previous plan period and put it back into the system. This will allow case managers to make edits or changes if something is different, but it won't create it won't continue to perpetuate providers not being able to bill for services. So this is in the works right now. It has not been implemented, but in the short term, the department has been working with providers to communicate out, alternative solutions for how they can get paid for services. We have a grant program that's out there that's available to them, as well as we've been working closely. The benefits team has been working really closely with the FMS vendor to make sure that if there is a PAR issue for a member, they're able to work through that so that there isn't an impact to getting paid on the 15th, but also the service is being delivered. So right now we don't have a large scale fix for all of those. We're working on those, but we're taking those escalations and the teams are working through them manually. The other thing that the team is doing is working on extending members' current benefit plans. So this will extend the benefit plans for a year going forward, so that if there is not a benefit plan in the system, this will then create one so that providers can continue to get billed. Sorry, words are hard this afternoon. Can continue to bill for those services, because providers need the 2 things. They need the benefit plan and the PAR in place for billing. All right, on the next slide, we have the care and case management system. And when we went live with the new care and case management system in July, we migrated over 118 million records from the 2 legacy systems into the care and case management system. And so when those records transitioned over, some of the migration of that data created some challenges with the way the system is supposed to work. And then there's known issues in the system that have also created some significant challenges for case managers in various day-to-day work that they need to do. So if we go to the next slide, we have worked on creating a data cleanup action plan, really cleaning up any of the data that migrated over, as well as any other components that have created challenges. For example, the reporting from the system because of the data has had some challenges. And so members who may no longer be on programs or receiving services, they migrated over as active. And so trying to clean up the records and making sure that all of the case management agencies have their rosters of members that they serve. We've also been working on reports that are really able to help case managers and case management agencies with doing day-to-day work and tracking members and the services that they're providing. We also have known issues and trying to provide updates on the known issues and when estimated fixes are going to go in place, and keeping that on our website with and updated on a weekly basis. So really trying to make sure there's transparency around all of the known issues and when those fixes will be resolved. We also have done some on-site visits with the case management agencies who are experiencing the largest backlogs. And part of it is just some of the size, but some of the data transitions, but also learning this new system when it had some defects. This creates a lot of challenges. And so sitting down with them and understanding from a user experience how we can improve the system and make it better for everyone across the state. And then we are, for the case management agencies that are also experiencing some challenges, meeting with them on a monthly basis and really looking at their data to help support them and identify solutions and strategies to get caught up. If we go to the next slide, I got a little ahead of myself because of the system and the challenges, that we do know that there are backlogs with intakes, with level of care, both initial and reassessments for our continued stay reviews, and then the initiating the PAR requests. So that's where we've leveraged some ARPA funding to be able to support case management agencies and retention payments for the case managers. Really trying to make sure that we can retain as many through, just the challenges of learning a new system, but we also are transitioning all of these agencies and trying to retain the case managers because right now things are really hard. But there's the programs. There's a lot of programs out there, and trying to recruit and retain case managers is super important for us so that we don't have turnover and lose that knowledge of the programs and working with members and being able to really develop that relationship. And so working on lowering caseloads across the state. So really getting to a size where it's one case manager to 65 members as the high number. And so monitoring that with case managers and case management agencies on where they're at in those transitions. So if we go to slide 13, the last one here is the communication gaps and making sure that we're able to respond to stakeholder requests for increased communications around issues and solutions so that there's not a gap in understanding from what the department's trying to do to make sure that we hear the challenges that you have. I heard somebody say something about all of the different forms and the notices and the information and really trying to make sure that we're improving those efforts so that we don't create more confusion while most importantly, not having negative impact to the services and accessing the services. So if we go to the next slide, based on feedback we received, we've created a new website, which is a landing page that really is intended to help navigate all of the issues as it relates to public health emergency, the care and case management system, and the transitions for members and community partners. There is an escalation form on there so that if there is some challenges or difficulties, you can complete that. And we have a joint team that works with the counties and with case managers to navigate the solution and resolution for individuals. We also have a new member correspondence around the 60-day extensions in development, and we've worked with a small group of members in a couple different settings to really try and get some insight and review of those documents to make sure that they are clear and not confusing and are short and sweet to the point. We also have created a case management agency toolkit to really help our case managers in communicating all of the different challenges that are going on. There's messages for them, for families and for members, for providers, and they're translated in both English and Spanish that they can share as they're working with individuals. And then creating more regular meetings with stakeholders to give updates on these 5 stabilization activities, hear input on, what's missing, what are some of the new emerging issues that might be rising out there, to make sure that we have a regular cadence of touch points and check-ins. So I'm sorry that was kind of a lot, but I wanted to give an update on all of the different moving parts that the department's working on and tracking really closely. And then happy to answer any questions that anybody has.
Well, thank you for that, Amanda. Great job. There are a few questions, and I see Robin has her hand raised as well as anyone else. Before we get started, some of them in the chat. One was from Cheryl Brown mentioning, does the extension apply to medical cert only, or does it extend to services being covered as well?
It extends to services being covered as well.
Okay. I threw in here because I know it's a part of allocations. I'm assuming that they do not roll over from fiscal year to fiscal year, but maybe you can clarify how allocations will roll over, if any at all.
Yeah, I appreciate that question. This is an area where we are still working through, how we're going to operationalize that and what it looks like when we actually copy those or duplicate those over. So I don't have the answer to that today, but certainly we'll make sure that that's part of the communication, because we need to be very mindful of that.
Okay. And then Robin put one in here that I know has been a concern for me as well. This happened as well several years ago. Without a PAR, attendance cannot be paid on the very first day that the PAR is expired. There is no grant program for CDASS. How will this impact it? I guess my question is, will they be retroactive?
So thank you for that. So I know that the team has had conversations and has worked with both of the FMS vendors to make sure that regardless of whether there's a PAR or not, that the attendants will be able to get paid. We have also have a list of anyone who doesn't have an active PAR that we are going through and manually correcting each and every one of those so that there isn't an impact. Now this is prospective, right? And so we have to work on the retrospective component. When you're talking about the grant funding, I would need to take that one back around. I think you're asking Robin about the PPP program or the Triple P. And so I think some of the strategies that we've put in place going forward will address that, but I need to take that as an action item.
Okay, before we move ahead much further, Robin, you have your hand raised, and since we're talking about yours, could you enlighten us a little bit more in your question?
Sure. I just know you had said, and I know for agencies, I'm looking at long-term care. So agencies have the ability to ask for, I saw some stuff about it, say, oh, can we back bill or get a grant because we're going to go out of business if we don't get paid soon and we haven't been paid in 3 months. CDASS doesn't have that ability. So once they're PAR, but I think you're addressing it in that once there's no PAR, we can't pay attendance. So on that very day, when the FMS looks into the system, there's no PAR, nobody gets paid. And in some cases, people don't show up, rightfully so. They can't clock in and out. So that was my one question, which I actually think you answered. But the second question is, I do a lot of advocacy, and we have many appeals in the line for these mistakes. And that's you're looking forward, okay, the backwards is, and the level of stress on a family when they're looking at going to an ALJ hearing is just huge. Is there any way we can mitigate some of that stress and look at those appeals before families have to go to a hearing?
Yeah, I hear you, Robin, and I think I really appreciate that because absolutely we've got to figure out I mean, we're getting to a place where now we know, right? Like who's missing that par or who's impacted by that. And so sitting down with our appeals team and making sure that we can cross-check if there's somebody who is appealed or that we can try and get ahead of it and address
Yes.
that before they have to go to court. And so we need a little bit of time to work through that, but it is something that is on our list of in short order to get ahead of.
Right. And from the perspective of Colorado Cross Disability Coalition, what we tell everyone is the second they get a denial letter, they file an appeal, immediately. So there is, it's to protect their benefits. So there are quite a few. I can only think of all of the cases I'm working on. There's only one that does not have to do with all the rest are procedural mistakes. And that's out of probably, at least half a dozen or more.
Okay. You broke up for
and that's
just a
just me.
second there.
Oh, sorry. I'm just saying most of the appeals I know that I'm involved with, they're almost all procedural mistakes.
Mm-hmm.
And so settling them would be amazing and take a lot of stress off of families. So thank you.
Yeah, and I appreciate that. And I agree. When we're asked, what do we tell families? Like case managers are asking us too. It's taking us a while to go in and figure out on an individual case by case what's going on. Is it a county procedural issue? Is it a case management CCM issue? And so erring on the side of filing it. But now, part of the challenge we have with this streamlined eligibility mismatch, the county might say that they've reinstated services and the case manager isn't able to get the par. And so that's where we're really trying to work as quickly as we can to fix the system. And then we're working through the appeals so that we know who really is a procedural versus a system fix. And so giving case managers a little grace and space there as they're working with the department. And then Robin, we certainly will continue to communicate how we're going to handle the appeals and what our strategy is to try and absolutely address those that shouldn't appeal or shouldn't need to go through the appeal process because of a system or procedural issue.
Yeah, it's a waste of everybody's time.
Exactly.
Thank you.
Yep.
Anyone
by the
else
way,
raise your hand? Great information so far. Anyone has appeal, I do recommend if they need to take the steps. I do see that they have the website listed. Danny did put that in our chat if anyone wants to make a copy and save that information. Not a bad idea. And I just want to share with everyone, after the last meeting, there was a lot of passion regarding this. And I had an even further conversation afterwards. And I think a lot of steps were made as a result of our meeting here, sharing now how important this is. So special thank you, Amanda, for joining on this here and helping clarify things.
Well, Kurt, if I could just share, I just want to say thank you to you all because I know that this has been really challenging and frustrating, and for communicating and sharing with the department to helping us get to where we are able to implement some of these shorter and longer term strategies. And I know that, a lot of what we're talking about is going forward. And so we are very committed to making sure that we look back to July 1st on how we can resolve outstanding or, issues that were a result to that. So I just want to make sure that folks don't, hear me say a lot about what we're doing going ahead, that we are looking back. And so I do see somebody put in the chat that they're having issues for one in January. So I'll put a link to the escalation. And if you could fill that out, our teams at the department, both the county and case management teams, will help get that resolved.
Outstanding. I'll just throw out to everyone, I really appreciate it. This is a self-directed program, so everyone has to remember they got to take the initiative to make things happen. So again, thank you, Amanda. Any other questions for Amanda or anything else before we keep on moving down? We have a little bit of time left here.
Kurt,
Okay,
I
Danny,
have one quick question.
Go ahead. Sure.
since we have just a minute, could I answer the question that came up earlier about training around with CFC and some of the work that's happening there? So you don't have to have some, like, we can come back next month if that's your preference, but I can also share, and I think Michelle Morris did a great job. But we are working really closely for, especially with CFC, to make sure that there's training for all case managers in advance of implementation so that they understand all of the different programs. But as part of case management redesign, you know, all of the case management agencies historically maybe didn't serve all the populations and all of the programs and services we have. So the department's created new training for all of our case managers, and we track it in a new learning management system so that we can also identify if an agency or maybe there's some areas that need some improvement. We can really hone in and identify additional training. So making sure that we provide training to case managers. Historically, we haven't done that. Each agency has had to create their own training materials. And so there's a very robust training that's being developed, and it will be available for case managers around IHSS and CDASS, and we work really closely with the team, but also all of our other programs. So we can get more information to you all about all of the different training that's being developed and in the queue, but I just wanted to touch on that before.
Sure. No, I appreciate that. So my understanding, right, that these are going to be mandatory trainings for case managers?
That is correct.
That is outstanding to hear. All right. Thank you very much for that, Michelle. Anyone else before we move on?
Michelle's hand is up.
Okay, Michelle.
I actually just have a quick question for either Amanda or Danny. It's probably for Amanda, but the link that you just put in the chat for the county relations membership form, and then the link, the new website that you guys have created with the escalation form, is that something that family members or participants, what is the best direction for them to take if the provider is not going to provide services because there isn't an active PAR? Is there something that the families can take initiative to do?
Yeah, thanks for that question, Michelle. I would certainly encourage them to use that form, the escalations form, because then that will be the quickest way for the team to look at, you know, is it something we need to do with the counties? And then the county relations team will work with them. If it's a case management thing, our team will work with the case management agencies directly for resolution. I'll also just share that the department is getting ready to put out communication for providers in the event there's not an approved PAR in the system and how to navigate that. So hopefully that, and then we'll provide case managers that communication so that they can share it with families and providers as well. And I think that will help address kind of this a more immediate issue and concerns around not getting paid or able to continue to provide services.
Is that, and I'm so happy to hear that you guys are going to be providing that communication to providers. Does that also include hospitals?
We can get it out to the hospitals, yes.
Okay. I've just seen some families having issues with hospitals as well. So if you wouldn't mind including like insurance verification with the bigger hospitals or something of that nature would be helpful.
Okay, I'll take that one back to the team.
Thanks.
I have a question, Amanda. When I went through this back in December, January, there was like an 800 number for the buy-in program or some number where I actually got great response from the state. Do you happen to have that number or to know what that was as far as calling someone?
I don't. I apologize.
I got that from my case
To
manager.
call somebody
actually.
to get help, maybe our member experience center. I can get that number.
Yeah, if you could get that, I think that'd be helpful.
Yeah.
I just think some people work better by phone call as opposed to text, email, and even finding websites can be a little bit challenging. So sometimes
Absolutely.
the phone number is the best. All right, great. Anything else, anyone? Great conversation. Thank you again, Amanda. All right. I actually only have one thing here before we go to the break, and I just wanted to throw it out on the floor. Discussion was a while back about are we ever going to meet in person again? Everything was thrown out from, certainly there's a lot that goes into meeting in person. Is there a benefit to it? Do we want to do it once a year, twice a year, quarterly? I just want to throw that out there for open discussion if anyone is interested at all in talking about meeting in person again. And for those of you who haven't been around for a while doing it, basically it was a wheelchair accessible venue always. The biggest thing is finding a room big enough to handle everyone. Speaker systems, calling options, things like that were always a consideration. So if we did want to do something like that, it would take a bit of planning. In the past, I was able to negotiate some things with people I knew in the community. Just throwing it out there. And is that a desire, or are we happy with doing these meetings like we are now? If you want to talk, unmute *6.
I think, Kurt, that it probably has a lot to do with the collective of individuals, because to achieve a venue like that, to cover the common amount of people we have for this meeting, if we even have, half those parties in consideration going, well, it's just easier to be online, then it kind of defeats the purpose of trying to acquire a venue like that, really. But if we do have a committed set of amount of people that, barring any sudden issue that prevents that attendance, if there's a commitment, then we can target maybe that group and provide the call-in option to attend the meeting for those who cannot attend in person. And it might give satisfaction to all parties in that way.
Right. We always had the call-in option. I think a lot of people do that. Jay said, I appreciate that. We could do a survey to see if there's interest in it. I want to say technology has went leaps and bounds compared to what it used to be when we did meet in person pre-COVID. And I think we've all gotten used to raising hand and proper etiquette for Zoom calls or Google Teams, or Google or Microsoft Teams. So I think that's a good idea. Maybe we can put that on the next agenda as trying to figure out if we want to do a survey for that or not. Michelle, I see you have your hand raised.
I had put in the chat that I was happy with virtual, and I just want to kind of expand on that a little bit. I think just given the current environment that everybody's dealing with all of these challenges with staffing, with active PARs, things like that, I kind of foresee this continuing to be an issue potentially through the end of 2024. So my suggestion would be to maybe take this topic and this question and kind of table it until the long-term care piece kind of stabilizes, and then maybe have that conversation again now. Because I can tell you personally, as a parent, there's no way. I mean, my day is full of trying to make sure everything is working the way it should. And as Robin mentioned, making sure, providers are showing up, we're getting paid to take care of clients. This is kind of where our focus is.
Right. Okay. We'll definitely consider that. I think that might not be a bad idea. Danny, you had mentioned about that our CFC update was going to happen during the break time, or right? How did we want to move forward with that, Danny?
Yeah, Kurt. So I think our CFC folk are not going to be able to attend the meeting until closer to 3:10. So they were planning on doing their report out during the breakout room report out. So when we do the report out from the breakout rooms. So I think we have 10 minutes that we can play with. I don't know if that's the preference, or if we just bump everything up a little bit.
Well, let's see what we got here. I do have up, I could give an update on our goals meeting that we had together. With that, I can see if I can share my screen where we came up with a pretty good meeting we had. I was going to bring that up after, but we can also do it now. see if there's a way I can share my screen. I'm getting better at this, but it takes me a little bit of time. Okay, where is it? Okay, hopefully everyone can see this here. Let me get to the top real quick. So, a group of us got together. I'd asked for a committee to establish goals, values, and how we're going to move forward with the PDPPC group. We had great participation and feedback. We had our first meeting a week ago on Friday. And this is really what we come up with here. And I just kind of went right to the top. So I just want to throw that out to everyone, what we kind of collaboratively came up with. And we started out with our mission. I think any good company should start with their ultimate mission of where they're at. And we list it right here, working collaboratively with all stakeholders and the state of Colorado to continuously improve self-directed programs through effective policy change. Really, I believe is a nice defining moment of the PDPPC and what we're all about. With that, we decided that there's certain values that we believe in, and I took a lot of this right out of the training manual and kind of expanded upon it. Basically believing that people with disabilities and their families have the opportunity to live independently, direct their own care through self-determination. It includes the main purposes of freedom, budget authority, including offering a viable living wage and employer authority, support in the community as well as at home, assume the personal responsibility that is required to implement and maintain these programs, and therefore giving us personal confirmation that we can direct our own care and take a leadership role in the community if we choose to. I'd just like to mention this as a matter of when we have our meeting, we can keep all of our meetings with the idea of our mission ultimately and what our values are. I think it's the best way to keep moving forward and stay focused on what we want to accomplish. Certainly when we get done here, I want to open it up to everyone else if we have time to maybe add their 2 cents worth in this. But we really had a really good productive meeting as far as moving forward. We went through the meeting, some of the minutes, we agreed what we were going to be doing. We clarified those values, and that's what we came up with finally. And then we had a true brainstorming session. Basically saying no bad ideas. Any idea that we want to do as part of our goal, based on our values, things we might want to improve. We came up with those, and I want to make sure we throw them out to anyone. These are just what we came up with. So we didn't argue about whether it's stupid, bad. We didn't try to solve anything like that. We just throw it up there against the wall, see what sticks, and then we'll move forward from there. So list here is sort of what we came up with so far. I'll just kind of share that if anyone has any ideas of things that they would also like to have as part of this goals moving forward, please include those in the chat, and we'll continue going through that moving forward. So the ultimate goal, and some of these we already accomplished, I just took the initiative, is our 2-minute rule for talking, for example. I heard a lot of feedback about that. We want to keep things moving and being progressive, not lingering on something too long. But we heard a lot of feedback where people just didn't have the time to get their thoughts collected in that time. And therefore, we want to make sure that we allow people to expound upon things or think of things as they talk, all right? So that's one thing I think we just kind of move forward with. I'd like to move forward with that moving forward. And the other thing that popped up a lot that I just want to address right now is what we call personal protected information. Different levels of that. You realize that you're sharing things, and this is kind of in a public venue here, in that we want to make sure that you're only sharing stuff as needed. However, we're not going to tell you just to not mention something. Really, please understand, as I started out with, that you are sharing that, And then everyone else out here, if you're listening to it, you hear something about someone, please understand that you really cannot share that with anyone else. It's a matter of their HIPAA protection as anything else. So that's come up from time to time. So there's a couple of those goals that we just threw out there that if everyone agrees to that moving forward, we can keep moving forward with that. All right. So this is basically what we came up with. We had some other notes and everything for the buy-in program for children with disability. I've added some links that we shared. Thank you, Michelle and others, for volunteering and showing that information so we have it available. I've also added some of those actually just now from the chat that I'll keep throwing on here as things we can move forward with. Last but not least, I wanted to share that we have got this set up with the idea of having 3 meetings. We've got information here regarding what we're going to talk about the next meeting, keeping in mind what I call SMART goals. This is not something I just invented. This is something that's been along for a long time. Basically with the idea of them being specific, measurable, attainable, realistic, and timely. And timely is probably the biggest one. That's the hardest part of this, is keeping things moving forward and making things happen. And hopefully we can continue to do that and be successful here, right? And then finally, hope we're going to wrap up with that. We're going to kind of pick our main priorities. I call that my big rocks versus the little rocks. A lot of people maybe heard of that 80-20 rule where, 80% of your problems are caused by 20% of the issues. So if we can pick those 20% and solve 80% of the problems, I think we'll go a long way to keeping forward and successfully move forward in this collaborative. So with that, I just want to share that was kind of our report that I had from our meeting. Any questions? I'll just open the floor up to anyone who wants to add anything. Nathan, I see you got your hand up.
Something I noticed very quickly on your list there, and I think it's going to be very effective. It appears you've recognized the opportunity to use the existing program and its methods to achieve these goals, such as I noticed that there's a comment there: authorized representative paid at hands, administrative is a time allocated task. In my just observation, that's a genius process, because we train in this program to recognize that if we have a service as an authorized representative or a member that is not being connected, how to categorically identify that and present it to a case manager to gain authorization. So if we can create an avenue that does allow the administrative tasking of authorized representatives to be paid as administrative tasks through the program, then it can gain approval very easily.
Great. I agree.
Well done.
I think, and that's the thing. Like I said, there were no bad ideas. We threw it out there, and we're going to pick the main ones and see if we can accomplish them. And of course, we got to work collaboratively with the state as well. Anyone else out there and comments that they might have? And a lot of this is an accumulation of our last multiple meetings throughout the last year and how we're going to move forward with it. But you'll see things like, I think the number one is increasing caregiver wages. It's an ongoing battle as far as what a livable wage is for the people who are basically giving up their livelihood often to take care of us as participants on the program. One thing coming up, age appropriate pediatric tasks, maybe. Again, just more and more options. I know the Latin American community and immigration, finding good caregivers is available, and maybe there's certain options maybe available for that. So we're just throwing other things out there. If anyone has anything and wants to share it right now, I'm fine with that. I think we have a little bit of time left before we have to take a break. I see Robin, remove barriers to consumer-directed services, including IHSS, to expand consumer direction to other services. I like that idea a lot. I think I've looked at that in other states as well. It's a nice option as far as what other goods and services might be available. It's been a long battle, and trying to get that implemented now might be the time. I'll make sure to add that to my spreadsheet. Anyone else out there? And sorry, I cannot see the screen. Anyone have their hand raised up? I'm just going to stop sharing my screen then. right. All right. I think we'll do this then. I see it is time for break here. Actually, we didn't have break scheduled at 2:35. Would we like to take break a little bit early and then come back for the breakout rooms? If that's the case, anyone have an issue with that? Or maybe I could even ask, I see staff and Danny, you had an overspending protocol review. Would you be prepared to talk about that right now before we got the break? We got a little bit of time left.
Yes, I can absolutely jump in, and then that way we get closer to back on track so the people who just show up for breakout rooms aren't going to miss it.
Right.
Yeah, I can go ahead and speak to that.
All right, all yours.
Alrighty. Thank you, Kurt. Thank you. And I apologize. I'm trying to find my notes again so I can share that with you
We'll give
all.
you time.
Okay. Where did my Zoom go? There it is. Okay, so I'll share the screen just to put the timeline back on here so it's relevant for everybody. This document that I'm sharing here is the response to the recommendation that we sent out to the group last month. So if you haven't already received this document, you can find it on the PDPPC webpage, or if you're on the mailing list, check your emails because we did send it out last month. But I will just jump right into it. I wanted to provide a few quick updates about the response of expanding the overspending protocol a little bit. So I'm excited that we're working towards making improvements to the overspending protocol and creating some additional flexibilities for our members. I want to provide a few quick updates on the timeline and how things are going. And I want to solicit a little bit of feedback from you all about some next steps. So first and foremost, just wanting to let everyone know that we are on track to have regulation updated by the end of July. And you can see on the screen here, our target date is July 30th. And here are the dates that we are striving for. So our next big step is our public rule review. I have already begun drafting the changes to rule. Not quite ready to share with a large group yet, but have started drafting that and will be prepared to hold the public rule review by April. I also would like to draw your attention to the change in HCBS rules that occurred in March. I think many of you, if not all of you, are aware that through case management redesign, there was a huge overhaul to all of the HCBS rules, and those took effect on March 16th. And so the regulations that were cited in our response to you all, which were the 8.510 and 0.6 and the 8.510.17, both of those regulations have moved to a new section of rules. So the 8.500 regulations are no longer effective, and they now live in the 8.75 realm. So we will be revising those regulations instead. Same terminology, same concepts are there. They just have different number citations. Let's see, I have also begun the process to revise these regulations to align with the overspending requirements that we put in the response to you all. My big ask for this group, though, is if there's a preference to have a separate public rule review meeting to discuss the minor regulation changes that will be putting in regulation to align with the new overspending protocol, or if the larger group would prefer to have the rule review occur during April's PDPPC as an agenda item. So I just want to take a minute and pause and open that up and get your feedback before I move on to any of the other updates. Or if you have any questions, I can answer those now too.
Anyone have any questions? So I just want to share with everyone, just as a quick refresher, quite a while back, and as you may know, that right now you cannot spend more than 130% of your allocation. It will not be paid out, even if you have the money in reserve. This is a process we're trying to change, and it has been approved. And this is what Danny's explaining, how we proceed with those steps. So do we want to have some public view as far as, is that what you're asking, Danny, as far as maybe in our next meeting?
Yeah, good clarifying question, Kurt. So anytime we do a rule revision or change a regulation, we do need to do a public noticing opportunity. And so I wanted to ask this group specifically because you are the stakeholder community that suggested these changes. If you feel it would be beneficial to do a rule review in a separate meeting, or if you would like me to bring the rule review to PDPPC for next month, and we can just do the rule review there and advertise it to the public to come to this meeting instead.
For one, I would just soon have it here as far as an agenda item. I think it's a great venue, get more people interested and involved in what we're doing. I'll throw that out to anyone else. Any other comments as far as maybe including that in the next agenda? Yay, nay, don't care.
Okay, I will take your comment, Kurt, and take that back, and then we'll have more information to come on next steps about the public rule review. Nathan, thanks. I see your comment in the chat.
All right. In a first and a second.
Okay.
Wonderful. All right. Well,
Alrighty.
everyone, we're making good time here. Anything else, Danny?
Yeah, I did have just a little bit more to add for this group. I wanted a little bit more feedback here. As you'll see on the timeline, one of our next steps is amending the CDASS overspending protocol. This is another area where I'm hoping to get some feedback today. We obviously need to update the overspending protocol to include the allowance to spend over 130% of the budget, of the monthly budget, excuse me, if there are reserves. My question for this group is there any interest to develop a small work group to provide direct input to us at HICPUF in changes to the overspending protocol, or is there more of a preference for the PDP team to make the minor adjustments to the overspending protocol and then bring that back to you all more as a presentation as opposed to getting direct input on updates to the protocol?
Are we talking about for the current achieved changes, or are you talking about for future changes?
I'm mostly talking about the current changes regarding the 130%. I think though, while we are evaluating the overspending protocol for the 130% addition, I am curious if there's other feedback that needs to be addressed, or if we want to open that up broader or just make the one small change.
I don't think it's a major change other than clarification. The 130%, I believe it was, if you had the 130% and got approval from the case manager. I believe that was part of it. Is that correct?
Yep. So yeah, that is correct. So as long as there's prior approval from case manager excuse me, there are reserve funds available to use, then spending over the 130% would not result in an overspending episode.
Right. And the other thing I want to throw out there is my understanding is sometimes case managers are really hard to get a hold of and not the best at calling back. I wonder if there's any contingency for that. And Patricia, I do see your name. We'll go to that next.
Yeah, I thought that was already in place, that if we wanted to spend over, we just had to get approval. I didn't know that it would flag as overspending. And then I'm wondering, are the case managers up on the overspending? Because I mentioned that one time to my case manager and she didn't seem to know the policy at all. That's all I
Great
have.
questions. Great questions. Let me answer those for you real quick. So you are correct with prior approval, or there's a couple other situations where a member can overspend. It does not result in an overspending episode. What's changing to the policy though is that historically, If a member tried to spend 131% or anything over 129%, that would get denied outright. It didn't matter at all. And an overspending episode would take place, and the timesheets would be denied for anything over that 130% threshold. And then to your second question about case manager awareness of overspending requirements, I do know that CDCO touches on overspending in their case manager trainings that, as Amanda addressed earlier, are mandatory. And they also provide additional topic-specific trainings for case managers surrounding overspending. So we definitely do encourage case managers to attend those as they're able to for additional information. And I want to pop over to the chat because I do see Robin's comment that we need it changed as soon as possible. And when does that change? And so just referencing back to the recommendation response, the soonest that we could possibly get this change in place is August 1st. For multiple reasons, one of them being we do need to go through the regulation change process because this is explicitly prohibited in regulation. And so we do need to follow the steps of going through the Medical Services Board and adjusting regulation to that effect. And we also are working very closely with our FMS partners to ensure that the systems are capable of managing this change, as there will be some system change requirements that they have to implement as well. So August 1st is the soonest that we can get this implemented. But as of right now, we are very much on track to do so.
Okay. Any other questions or comments?
I see a little bit of feedback. I believe it was Oliver reporting back to the group and don't need a subcommittee. And that's why I wanted to ask. I know that everybody is, I think everybody's probably in a state of overwhelm right now. I know there's a lot of things going on, just generally speaking, and definitely don't want to add additional work to anybody's plate or additional time commitments if it's not wanted.
Yeah, I agree. I don't think we need a subcommittee to write what rule we've already asked for. Just a matter of implementing. So,
cool.
Okay. Any other comments regarding that? I do see another comment in the chat. Before we get off to our break here, it says someone put in there, I wonder if agencies would also benefit from case manager training. Would it be possible for us to listen in or get slides for their trainings? Again, I'm assuming that's like IHSS agencies. I'm kind of curious what that is pertaining to. Yes, IHSS. All right. So maybe Adam, you could help. I think we do some IHSS training, don't we?
Hey everybody, this is Adam, Consumer Direct Trainers Operations Vendor. It's nice to see everybody today. We do a training for the providers, the IHSS providers that are required to get a certificate from us, pass a test for the licensure to be an IHSS provider agency. That's whom we do those for.
Okay.
And those are available right now only to those IHSS providers, those agencies themselves.
Well, the agencies themselves. Mm-hmm. So is that similar to case manager training as far as, and I think we were kind of more talking about before we get too sidetracked, because I know we do have want to go on break here. I think we were talking more about case manager training regarding time assessment and tasks and things like that. I'm not sure if that's what we're talking about regarding IHSS, and maybe PTSS, you can put that information in there.
Yeah, sure. You can provide our information. It's great. We do case manager trainings, yes, on enrollment process for IHSS, how that looks, what that involves, as well as the CDASS program. And those are also just for case managers. So I think what started this was, can people just sit in on them to see what they learn? At this point, I believe the answer to that is no. It's case managers come to their trainings, providers come to theirs.
Yeah. All right. Well, I think we are getting close to break here. It's already 1:31. Let's do a quick break, and I'm seeing on the agenda we have break time scheduled from now until, well, actually 2:35 till 2:45. Why don't we plan on all being back at 2:45, and we will go with the breakout sessions at that time, and then move forward with final reports and wrap up. All right. We'll call it a day. We'll see you guys back here at 2:45.
Thank you, Kurt.
Hi, everyone. Welcome back. I think we're just waiting on Kurt to rejoin and others. We're at 2:46 according to my clock. I'm going to go ahead and open up the breakout rooms just for the sake of time so we have as much of the allotted time for everyone to make use of them. As always, if you're connected through the Zoom app, navigate to the bottom of your screen where it has either 3 dots that say more or an icon that says breakout rooms. And you should be able to select the breakout room you'd like to join. Excuse me. If you're calling into the meeting today, just hang back and we'll help to get you into the breakout room of your choice.
Thanks, Jessica.
All right, I see people funneling in. This is great. Caller with the last 3 digits, 995. If you'd like to get into a breakout room, go ahead and press *6 to unmute and let us know which one you'd like to join. Caller with the last 3 of 280 and 640, you can also unmute by pressing *6 and let us know which breakout room you'd like to join. Of course, everyone doesn't have to join a breakout room. I'm sorry, go ahead.
Oh, sorry. Yeah, 9995. If I could go to IHSS, please.
Absolutely. There you go. All right, I'm going to leave you all to join the FMS case management and training room. And a notification will be provided when they are closing. So thanks, everyone.
Hello. I see the individual on the phone ending in 640. You unmuted. I, if you would like to be assigned to a breakout room, please let me know and I can assist you with that. Hello. Individual who is on the phone looks like the number ends in 640. Would you like to join a breakout room? Hmm.
Hey there, welcome back, everyone. I'm waiting for everyone to get on here. Breakout sessions. Hopefully I had a good meeting. I know something we might want to consider. I swear every time, at least in our session, and maybe the other groups don't have this, we're like right in the middle of just about wrapping some stuff up, and we could use like another 5 minutes or so. So something we might want to talk about at the agenda meeting is maybe having an option to extend a breakout session for at least our group anyways. All right. All right, why don't we got subcommittee reports, 310 to 320. Who wants to start? Let's start with FMS group. Any feedback at all you want to share or no?
I can jump in for that one. I think the most valuable thing to share is that we had a question as a follow-up to some of the training questions that happened right before the break. And it was, how can an attendant learn more about CDASS and IHSS enrollment and get more information about policy for those programs? And so, unfortunately, they're not able to attend, the case manager or IHSS agency trainings that Consumer Direct holds. But everyone should be reminded that Consumer Direct has a lot of good information and resources on their website that is accessible to everybody. And then Adam pointed out that they are holding their quarterly Employer 101 training Thursday and Friday this week. And so I'll put some links in the chat for any of you who are interested. And maybe during open forum, Adam, if you can just throw out your Consumer Direct's phone number, that would be great.
Yes, absolutely. It gives us kind of like little brush off of little sections, everybody, little breakout rooms of topic specific CDASS stuff.
That's it, passing it along.
I reckon that is me, maybe? Should I go?
Yeah,
I can talk about the IHSS subcommittee route.
Yeah,
we, Heather did a lot of talking. I subbed in because we had a few absences on the team here. So I did report on the IHSS statistics, 7,739 members, 1,614 are in the children's HCBS waivers, 6,125 are in the elderly, blind, and disabled, and the complementary integrated health waivers, and 281 IHSS agencies. And I did an overview of a lot of the direct care workforce stuff that is going on. Of note, we should have our training modules on our site in the next month or two. That site is the Direct Care Career Center, the Direct Care Center, which is already running and available with resources and job posting, job matching. So looking forward to that. We will also put on some soft skill modules for maybe new folks into the workforce. And then we are almost 100% solid on having Direct Care Worker Appreciation Week being the first week of April, recognized by the General Assembly. We should know probably a little bit more. The Direct Care Workforce Collaborative has worked on that. Last year, they were able to secure it. This year, it looks like it's going to be successful again, and it'll just be an ongoing week of acknowledgement. A really good opportunity for folks to be able to highlight the importance of the workforce and what is needed to support them, wages, benefits, all of those things. So that was kind of exciting. And we do have our last 2 months of their last 2 grant cycles are available. So if you're interested, please check out our website. We do have training grants available through August 30th, 2024.
Oh, Bryce, you got your hand raised.
Yeah, a quick question for you, Heather. You mentioned the Direct Care Careers website. Do you have any idea when CDASS participants will be able to participate in that? I've heard some different times.
Well, I haven't made up a time yet. No, we have we worked through rolling folks in. So I think really the only hiccup now is we just have to be able to make sure that we can job postings will look the way they need to look versus keeping protected health information aligned. So that's kind of what we're looking for. And so, I mean, I think we could shoot for May we would probably like to do some soft beta testing with it and kind of roll folks through. And so we'll certainly come back here, or at least try to make announcements through PDPPC for folks who might be interested in trying it out, getting their postings on and seeing how it works. So then we can either make videos or make tweaks or make it better for other folks. So John can yell at me, but I feel like we could say May is a really good start and that we would look at beta testing it first.
Great, thank you.
Kurt, I know that the CFC and folks are ready to present as well during this time. If I believe the CDASS and IHSS members do not speak out during the breakout. So if we're ready for Eileen, I think she's ready for us.
Yeah, agreed. I don't think we, from our subgroup, have anything really to share at this time.
Okay.
Agreed. Sorry, I'm having a hard time unmuting. All right, we're ready.
Great. Thank you so much. Sorry, I'm just get my screen over to the right place so it doesn't look like I'm looking up the whole time. Hi everyone, this is Eileen Saunders from the department. I am the CFC manager. And we just have one update today that we gave at our last CFC council meeting and our last CDAC meeting, and that is that we are now going forward under CFC when it launches in July of 2025. Personal care will be available to all ages. So personal care under CFC will be available to children as well as adults. That includes personal care under CDASS and IHSS, and parents can provide personal care to children to their child on IHSS or CDASS. So the details of all of that we are still working out internally at the department, but we just wanted to get that announcement out to this group today. And the other piece is that the pediatric personal care benefit on the state plan that currently exists, that will remain in place as well. So we'll have the pediatric personal care benefit on the state plan and the personal care service available on CFC. The reason for that is because of the level of care discrepancy. So in order for members to be eligible for personal care on community first choice, they need to meet institutional level of care. That is not a requirement for the pediatric personal care benefit. So we are leaving both benefits in place at this time.
Yeah.
Other than that, we don't have any other updates, but I'll just pause to make sure there aren't any questions. Okay, great. We are canceling our CFC council meeting for April, but we will resume in May. And that notification went out today, the OCL communication. So yeah, if you have any questions, feel free to email the CFC team. Otherwise, we'll see you in May. Thank you.
Thank you, Eileen, for the update. I'm not able to see Kurt's screen right now, and it says he's still muted, so I'm unsure if he's having some technical difficulties. So I will just jump in and say we have already hit our 3:20 topic, which was the overspending protocol with Danny. So next up is our open forum. Are there any individuals who would like to start the queue? All right, Nathan, you'll start us out. Are there any other individuals who would like to join the queue?
Oliver for the queue.
Oliver, thank you. Nathan, go ahead and take us away.
Yeah, I just want to make a real brief comment to kind of plant the thought. I put a comment in the chat just at the end of before we went to break, and hearing a lot of the comments, I think that what we're starting to see is that people are recognizing potentially the need for transparency among case manager agencies. We want to make sure that we're getting, when they contract for a state paid agreement, that we're getting the productivity out of them as we are. We're seeing a lot of good things happen already, giving recognition to that. But I think overall, at very least, we need to have some sort of oversight. And I agree that it's not just every person's opportunity necessary as a qualified opportunity to oversee that, but we do need qualified people to look at what they're starting with and where they're coming out at the end in productivity, because I feel like we may be seeing a classic goal of profitability as the driving influence in many cases, like many companies have. We do not expect a case manager agency to be a not-for-profit company and that be a requirement. However, if we don't have, there's a lot of bashing that goes on case managers, and we really want to protect them as employees and people when they're brought in to do a job that is seemingly at odds impossible. And if the funding that is provided is not ample, that's a concern. But if it is, and it's not being utilized appropriately to support those teams to do their jobs, we need to identify that, and we need to take corrective action in that mode, rather than hold it just individuals responsible for apparently not performing.
Thank you, Nathan. Great insight. And it looks like you've got some seconds in the comments as well. Danny, I see you've unmuted.
Yeah, I just wanted to say thanks for that feedback. And I'm not sure if anyone from our case management team is still here to be able to speak to what, if any, measurable standards there are in place. But it's definitely something I can take back and try to get some more information for you. And great points. And thank you.
Thank you, Danny. And next up is Oliver.
Yeah, I just wanted to mention a piece of legislature that's in the legislative session right now for the state, House Bill 1312, and it's gonna try to create a $1,500 tax credit for anybody in the caregiving realm. I just wanted to let people know that if they want and interested as an individual, we're not representing PDPPC, but we can, as an individual, we can go and testify on Monday the 1st. There's an opportunity. It's in the finance subcommittee. So yeah, I think it's a great piece of legislature, and it'll give a tax credit to caregivers, $1,500. So yeah, I think it's a great bill, and if you want to support it, I would encourage anybody to go to the Capitol on Monday.
Thank you, Oliver. Good to know. And Jessica, you have your hand up.
Yep, thanks, Sarah. I just want to return to one of the comments put in our chat by Amanda. Because it is a phone number, I thought it was important to read aloud. So this is the phone number she had mentioned for the member contact center. It is 1-800-221-3943. And then also Consumer Direct's phone number for those who might need it for resources or training questions is 1-844-381-4433. Thanks.
Thank you, Jessica. All right. Are there any other individuals who would like to join the open forum?
Yes, please.
Adam, sure thing. You can go ahead and take it away.
All right, I spelled my own last name wrong in the chat trying to sign in there, so that was cute. Yeah, just to kind of kick this in for the next 2 days, we will be putting on what's called Employer 101 workshop. We do this quarterly. What's great about these is that a lot of members on the program is after that initial training, they don't really go back through us and to kind of polish off on a couple of those things, like remember budgeting authority and employer, and we do all these little kind of like refreshers on each of those manuals. And there's, basics and advanced. We do stuff about employee taxes, little understanding EVV stuff. Who's the boss? I got to say, Kurt, if you can hear me right now, you're moderating this meeting and I'm super disappointed. You didn't plug that in over and over since you're the one giving one of the darn presentations. So, but yeah, Kurt knows it. He's a part of it. And we do help people, and anyone can sign up for it to kind of see how that CDASS works and how being an employer works. And that's on our website right now. And you can click on the calendar to see what's available. And I'll be sending out links to that today.
Thank you, Adam. And could you please tell us what CDCO stands for real quick?
Absolutely. The CDCO, we're the Consumer Direct for Colorado. Important to distinguish since the Consumer Direct Care Network operates in about 15 states. And you'd see CDCO or CDTN for Tennessee. So we're all over, but in Colorado, we're the training vendor, kind of that first point of contact for customer service guidance. What we do love to do is just provide that information where we can shield case managers who are very busy from a lot of those calls that get sent their way that never needed to be. And we can say, actually, here's how to kind of speak to it and understand what's happening, to kind of zoom out from the program and then zoom back in.
Thank you, Adam. And I believe Robin may have had a question in the chat that you may be able to answer. Robin said, has anyone answer CDCO aid referral?
Has anyone had anyone answer CDCO aid referral? I'm not sure what that is. What is an aid referral?
Okay, Robin, we may need some additional information on what the CDCO aid referral is. And then Heather, I see your hand is up as well.
I just had, oh, go ahead, sorry.
No, you go ahead, sorry.
In the IHSS room, Tracy had asked about if there was a date for waiver reinstatement. And so I did chat Amanda Lofgren. And so she said each month there's reinstatement work. So March 1st, April 1st. So it'll keep going on the first of every month until the system fix goes into place. So I hope that answers your question, Tracy. And if I'm not very clear about what I'm saying, you could provide sum it up for folks, that'd be great.
Thank you, Heather. And Adam, I see you've answered the question in the chat. I appreciate
Correct.
that.
I was given some information there too. Yes, the provider directory is great. We've been getting a lot of questions from people to either say, where can I register as an attendant, or where can I go to search for people that have registered, which is this really great tool that the provider directory lets them do. Most of the time we get questions for people going, can you hire me? I want more work. And I'm like, it doesn't work that way. But you can create a profile to be searchable as a caregiver by members needing it. They can just put in their information, like a profile, and then their caregiving tasks, and then a member can search for them, find them, and then reach out to them. Oh, never get anyone to answer. Oh, like you've sent out, hey, yes, I want you to work, Robin, and it never got back to you. That I can't help you with. That's on them. We did tweak the system though very recently. We did like a complete overhaul to get rid of old inactive profiles. So like this new one asks them to keep it alive. They have to like keep it updated and keep verifying they still wish to be a part of it, or it removes their profile after like 90 days, I think 3 months. But hope that
Thank you.
helps. It's like can't get them to respond back to you, but you can tell them where to go to look.
Hey there, everyone. My apologies. My computer overheated. I had to let it cool down again. So,
Welcome back, Curtis.
thank you.
All right.
Sarah, you got it. Where are we at, Sarah?
I believe we are about to close up open forums if there are no other individuals who are looking to join.
All right, so Kurt, do you want to close us out?
Yes, helps if I unmute my thing. Great meeting, everyone. Please feel free to share any feedback. My email address is in the PDPPC group, as well as the training manual. If you have any comments or would like to give me a call, I'll also give you my phone number right offhand. If you want to grab a pencil handy, my number is 720-220-9020. Anyways, and I see we got the request. Thank you, Jessica, for putting that out there. Anything else, please make sure to let us know. And great meeting, everyone. Thank you very much.
Thank you all.